started with radiofrequency ablation in 2005. At that time we used a multi-needle, a multi-prongs needle, and it was a little bit invasive. And then when we read that in 2008 Professor Baek had started with a thinner needle in Korea with good results, we managed to meet together. He came in our hospital in 2008, and since then we practice with this new technology and this new technique. Gives us a lot of very good results. So since then we are using that approach for the thyroid nodules. That seems to me still very effective and very new, because there are a lot of space of bettering the single treatment in order to give the patient the best treatment and to avoid them from unuseful and not necessary thyroid surgery. The protocol we follow is a protocol we set and optimizate in the last years, and needs a careful study of the neck, of the anatomy of the patient and of the nodule, and then after that the study of the characteristic of the nodule in order to determine the optimization of the treatment depending on the on the ablation of the vessel, or sometimes the study of vascularization with the echo amplifier, and that took us, together with the monitoring of the energy delivered, to optimize the treatment and to have generally very, very good results. There are many cases of patients in which we had a very nice feeling together. But I remember one of a young lady. She's an architect, and she had a nodule growing for which she didn't want surgery. So we managed to set the procedure just before she left for vacations. The problem was that she did vacation the day before, and she went horsing for 2 weeks, and when she got back she had an infection in the neck. So that situation could be dramatical, but with antibiotics and with strict follow-up, that nodule progressively shrank, and at the moment has completely disappeared. At the ultrasound you can recognize what it was, and it was a very large nodule. It was a 25-30 ml nodule, which altered the shape of the neck, and now if you look that neck, anybody couldn't imagine what it was. So it was a nice experience. She's a young lady, she is very happy, and we are very proud of this brilliant resolution of a potentially dangerous situation. We use sometimes, rarely, in spite of the benign nodules, radiofrequency to treat also parathyroid, especially if we diagnose a parathyroid inside the lobe of the thyroid. That happens because we have a high intensity center where we follow and see and diagnose many parathyroid. So that way of treatment avoids surgery and resolves everything in a brilliant way. The second application is on recurrent lymph nodes. We use for those cases of patients who have already been operated, underwent to radioiodine, but they recover. And in that case also, with the dissection, it's possible to ablate, sometimes definitely, sometimes at least to reduce the dimension of these lymph nodes in order to avoid the skin ulcer, which can appear when the lymph nodes enlarges in the time. We started with the training programs since many years, and at the moment many colleagues came all over Europe. I counted at least 13-14 different countries. We let them participate to the live ablation of 2-3 patients for every session they come, together with the theoretical part, which means ultrasound anatomy of the neck, all the review of the literature in order to set up which is the methodology in order to start, which are the results, and then the discussion of the cases at the end of the session. We found everywhere and in any colleague good satisfaction, and often when they start at home we go to proctor in order to help them to start and to be there when they begin to try with the first patient. A beautiful experience on a social and also professional point of view. Actually, we started with the first cases, really first case in 2004. In 2005 we published the first paper. Since then we treated more or less 1,200-300 patients. What makes us proud, me and my colleagues of the team of the endocrinology of the Mauriziano Hospital of Turin, is that we have generally very good results. Are very few the people who have a regrowth of the nodule, and so in this group of 1,000 and more people, just about 20 have been operated by the surgeon because the nodule continued to regrow. So our satisfaction is deriving from the fact that we avoided more than 1,000 unuseful intervention. These people are without pill, and asymptomatic, so they feel free from the compressive anesthetic problem. And contemporary, they come to us and they send to us other patients who they know in order to resolve this problem, which too often at the moment is still sent to the surgeon. So for us, for our group and for us, is a great satisfaction to having been a reference point for the treatment in Italy.